Hello, my name is Larry Massenburg, and the purpose of this video is to conduct a skin assessment on an adult male patient. And per the assignment directions, this patient is working as a volunteer basis, and he shall remain nameless and remain fully clothed. When we think about the integumentary system, it is the largest of all the body systems, and it includes hair and nails. Today we will be working systematically through from a head to toe exam to check for issues with the skin, and I will be commenting as I go through the different portions and parts and things that I am assessing. The purpose of the integumentary system is to provide protection and also adaptation. Adaptation relates primarily to heat and cold. Whenever we have a break in the skin system, we immediately think about the risk for infection increases, and so we should be concerned. Patients who have issues with mobility or limited or immobile, as well as patients who may be having frequent diarrhea or moisture present, oftentimes are increased risk for skin breakdown. Today we will be starting with the head assessment, and I just want to point out a couple of different things to keep in mind as you're doing the assessment. It is important to have your patient as comfortable as possible, accessible as possible. In an ideal scenario, this patient would have already donned into a gown for easy inspection of the skin. You also want to make sure that you have good lighting for the patient so that you can see the areas of the skin, and also as you move through the examination. I have washed my hands, and I'm going to don my gloves and begin the assessment. I also generally start with just asking the patient a couple of things that might actually help you in the skin assessment. The first being if the patient knows they have any skin issues, skin scars from previous surgeries and those kinds of things. That will help you. Also, you want to be sensitive to pain. Sir, do you have any scars on your body from previous surgeries?
No, sir.
Okay. And are you having any pain today?
No, sir.
Okay, so I'm going to stand and we're going to just systematically work through the body, starting with the head. With regard to, you can keep the head down, sir. With regard to the head, we'll start with the hair, since that is part of the integumentary system. We'll note the distribution, the color, the texture, and we're also going to feel the scalp very gently for any irregularities, any sore spots, raised areas, these kinds of things there, any obvious signs of breaks in the skin. We will assess the back part of the scalp when the patient is in the lateral position. Moving on to the forehead, also we'll make notations here. There are simple things that one can do. You also always want to compare one side to the next, as well as moving behind the ears, which is one of the areas that sometimes can be missed. And can you turn your head this way? There you go. And then to the other side, all the way this way. And we'll also check behind this ear as well. And then back. Thank you. Okay. Having the patient to close their eyes is an easy way to be able to assess the eyelids for any break in the skin. Keep in mind that the head itself should be considered a bony prominence. So a patient who's immobile for long periods of time always can have an increased risk for having pressure ulcers related to just being in one position. The cheekbones also sometimes can play a role in that as well. We'll then move on then and we'll check the face. And then turn this way for me again. We'll check there as well. And then the neck. And again, we'll check the posterior part of the body when the patient turns on to the other side. On that note, if you have a patient who is not alert and oriented and can't turn themselves, it might require you have an assistant to turn the patient to do it. Additionally, if a patient is in pain, you may have to combine or cluster this care, this assessment, with other care, such as when giving the patient a bath and or performing incontinent care. We will move on to the chest area here. Again, looking for any abnormalities as you're going through. You may have to adjust the light to be able to cover for that. Again, noting for anything and just kind of systematically working down. At this point, I try to go ahead and also check underneath the axillary area here. So I have the patient to raise their arm one at a time. I will inspect this area here as well as this portion of the arm. And then we'll do the same thing on the other side. If you can raise that arm for me. Oops. I'll adjust that. You will assess this area as well, all the way through. It may be helpful to have a pen and a ruler of some sort nearby. If you do find some kind of break in the skin or area that needs to be measured, that's an important part of your documentation. The skin in general should be even, colored, with no irregularities. Patients, of course, sometimes do have birthmarks. You might notice those kinds of things as well. You also want to check for temperature and color, and again, any type of rash or development that the patient may have. Moving on down to the abdominal area, we would check in a similar fashion here. This is an area that is a high area for surgical procedures. People had some type of abdominal surgery, gallbladder removal, these kinds of things. A lot of times you will see presentations there. If the patient has already mentioned that in your interview portion of the assessment, then just record that information down in there and include it. You may just for sake want to measure that area, and that would be totally fine to do so at that time. As we move down the arm, we want to check the elbow is another area that's a bony prominence that can, in fact, be subject to pressure, and sometimes the shoulder as well. We'll move down the wrist, and then we will check each finger's cuticles in between the spaces of the fingers on each hand. A lot of people do work with their hands quite a bit, and as a result, what can happen, you will get little tears here. This is a source for infection, and so good hand hygiene would be the education that we would include in that. The patient then can turn the palm up. We can inspect this portion of the arm and the hand as well, and then we'll move around and do the same thing on the other side. So we'll check down this arm. Again, remember that the elbow and any of the bends can be areas that sometimes get ignored. We'll move down to the hand, each finger, and in between. And we'll turn the hand over. We'll inspect the palm and this aspect. In hospital medicine, a lot of times the patient would have an IV because sometimes breaks in the skin are intentional in the sense that they have a surgery, they may have some type of dressing in place, or a simple one, an IV in place, or they could have some other type of serious trauma. So we want to make sure that we inspect those areas carefully. With regard to post-op patients, we generally want to follow the direction of the surgeon with regard to removing dressings. A lot of times they have a specific time or a specific frequency to change out the dressing. At this point, I'm going to have my patient, before I do the lower part of the body, to turn over to the left lateral side. And now we'll go back and we'll inspect the back of the head, again, an area that tends to be a bony prominence. We'll look for that. We'll move down this area here. The scapular, shoulder blades can also be areas of bony prominence. We'll be sensitive for pressure ulcers there. Inspect down the back. Again, always assessing for pain, difference in color, warmth, temperature, etc. We'll move down here. When we get down to the truncal areas, we have another area, the sacral area, and the buttocks are places for pressure as well. And while the patient is in this position, it's a great time to go ahead and assess the back or posterior portions of the leg. Again, the folds, any folds, we want to be very sensitive to for potential areas that sometimes get ignored. When we get down to the heels, Another area for pressure, we want to be sensitive to that as well. And we will check that out, as well as the ankles can also be areas for pressure and skin breakdown. You can return to your back, sir. For the purpose of this exam, with regard when we get to the pelvic area, again, you want to think any type of folds. Make sure you check for any type of folds there. And I did want to make a comment with regard to the differences in gender. With a lady, a lot of times you'll need to check the breast folds as well as the inguinal folds and the labial folds. That would be very important. And with the gentleman, complete assess the scrotal areas, inguinal folds, as well as the anus area. With the knees, a lot of times that people had knee replacement, these kinds of things, there may be a scar presentation there, other scars from surgeries there, or injuries to the knees. Looking for, again, any type of lesions, other breaks in the skin would be important to assess. Throughout this process, you want to document, measure as necessary for all of these different areas. We move down to the feet in a similar fashion that we did with the hand. We want to make sure we check each digit and in between on both feet for our skin assessment. I sometimes will include a set of vital signs with prior to doing the skin assessment. Also asking the patient if there are any type of medications that they take. And some individuals have chronic conditions like eczema and psoriasis that you may note there in your assessment as well. So it's very, very important, again, as you move through the body to do a head-to-toe exam of the skin, to note the areas that are suspicious for pressure, knowing what's normal with the skin, and documenting temperature, warm color. And of course, as we age, the skin tends to lose its elasticity. So you can check the area for tinting of the skin, these kinds of things. Document whether or not the skin is very thin, and sometimes from prolonged use of certain type of medications, or sometimes the patient may be acutely experiencing skin condition in the sense as a reaction to a medication. So all of those things we want to be able to document very, very well. If you're in a clinical situation where you have a wound team present, it certainly would be appropriate when there are any abnormalities to have a wound team come in to further evaluate the patient and to generate a plan of care, help generate a plan of care for your patient. Simple things that we can do if there's issues with mobility. If the patient is able to walk, we want to try to get them up and moving as soon as possible. We may employ, if they're not able to do so, Q2-hour turns to help prevent waffle boots, or sometimes floating the heels would be appropriate as well. We never want to do anything in our assessment that's going to be too painful to the patient. And again, we want to notice what is normal for this individual and any new presentations in the skin, and we want to document as we go. So that is a very basic head-to-toe exam on an adult male client, focusing on the integumentary system. Again, that includes the skin and hair and nails.